Hey everyone, hope you're having a great day. You're listening to the RX Daily Dose. Today's episode is being recorded for Monday, May 18th, and I'm your host, Ian Parnagoni. We update this podcast every week for healthcare providers, medical professionals, and anyone who has an interest in drug updates. Don't forget to like, share, and subscribe on all your favorite podcast platforms and social media, including iTunes, Spotify, YouTube, and Instagram. All links can be found in the show notes below. This week, we have updates for you from the FDA on approval of Retevmo for multiple types of cancer and approval of Qinlock for gastrointestinal stromal tumors. We also have new indications to talk about with Rubraca and Lynparza, and we'll also be giving our regular update on coronavirus numbers to date. I'm also including times for each section in the show notes, so feel free to skip ahead for any area that might interest you. Let's start with the first one from this week. The FDA approved selpercatinib, which goes by brand name Retevmo, to treat 3 types of tumors: non-small cell cancer, medullary thyroid cancer, and other types of thyroid cancers in patients whose tumors have a specific gene mutation. Retevmo is the first therapy approved specifically for cancer patients with the RET gene alteration. RET stands for rearranged during transfection. Retevmo is a kinase inhibitor, meaning it blocks the kinase enzyme and helps prevent the cancer cells from growing. Before beginning treatment, the identification of a RET gene alteration must be determined using lab testing. The FDA approved Retevmo on the results of a clinical trial involving patients with each of the 3 types of tumors. During the clinical trial, patients received 160 milligrams of Retevmo orally twice daily until disease progression or unacceptable toxicity. The major efficacy outcome measures were overall response rate and duration of response. You can take a look at the FDA notice for full efficacy data from the study in all 3 indications, but one that will give you a good idea of the results of the trial is for non-small cell lung cancer. Non-small cell lung cancer was evaluated in 105 adult patients with RET fusion positive identified and who were previously treated with platinum-based chemotherapy. The overall response rate for the 105 patients was 64%. For 81% of patients who had a response to the treatment, their response lasted at least 6 months. Efficacy was also evaluated in 39 patients with RET fusion positive non-small cell lung cancer who had never undergone treatment. The overall response rate for these patients was 84%. For 58% of patients who had a response to treatment, their response lasted at least 6 months. The most common side effects with Retevmo were increased liver enzymes, increased creatinine, increased blood sugar, decreased white blood cell count, platelet count, and electrolytes. Side effects also included decreased albumin in the blood, dry mouth, and diarrhea. Retevmo can cause serious side effects including hepatotoxicity, elevated blood pressure, QT prolongation, bleeding, and allergic reactions. If a patient experiences hepatotoxicity, Retevmo should be withheld, dose reduced, or permanently discontinued. Patients undergoing surgery should tell their doctor as drugs similar to Retevmo have caused problems with wound healing. Also this week, the FDA approved ripretinib, which goes by brand name Qinlock, as the first new drug specifically approved as a 4th-line treatment for advanced gastrointestinal stromal tumors. That's a type of tumor that originates in the gastrointestinal tract. Qinlock is indicated for adult patients who have received prior treatment with 3 or more kinase inhibitor therapies, including Gleevec. Each year, approximately 4,000 to 6,000 adults in the United States are diagnosed with a gastrointestinal stromal tumor. Commonly referred to as GISTs, they arise when abnormal cells form in the tissues of the gastrointestinal tract. GISTs most commonly occur in the stomach, small intestines, and large intestines, but can start anywhere along the GI tract. Qinlock is a kinase inhibitor, meaning it works by blocking a type of enzyme called a kinase, which helps keep the cancer cells from growing. Qinlock's approval was based on the results of a clinical trial that enrolled 129 patients with advanced GIST who had received prior treatment with other FDA-approved targeted therapies, including Gleevec, Sutent, and Stivarga. The trial compared patients who were randomized to receive Qinlock to patients who were randomized to receive placebo to determine whether progression-free survival was longer in the Qinlock group compared to the placebo group. During treatment in the trial, patients received Qinlock or placebo once a day in 28-day cycles, repeated until tumor growth was found, or the patient experienced intolerable side effects. After disease progression, patients who were randomized to placebo were given the option of switching to Qinlock. On average, the progression-free survival rate in patients in the Qinlock group was 6.3 months, compared to 1 month for patients in the placebo group. The most common side effects with Qinlock were hair loss, nausea, abdominal pain, diarrhea, decreased appetite, and vomiting. Qinlock can cause serious side effects including skin cancer, hypertension, and cardiac dysfunction, which is manifested as a decrease in ejection fraction. That's when the muscle of the left ventricle of the heart is not pumping as well as normal. Healthcare providers should routinely check for symptoms and signs of these and other risks of Qinlock. The FDA this week also approved a new indication for rucaparib, which goes by brand name Rubraca, for men with BRCA-mutated metastatic castration-resistant prostate cancer who have previously received androgen receptor-directed therapy and taxane-based chemotherapy. Rubraca was first approved by the FDA back in 2016 for BRCA-mutated ovarian, fallopian tube, and peritoneal cancers. There are limited treatment options for patients with metastatic castration-resistant prostate cancer, including androgen receptor targeting therapies, taxane chemotherapy, radium-223, and Sipuleucel-T. The agency granted accelerated approval based on the single-arm Triton-2 study involving 386 total patients, all with different BRCA mutations and disease measures. The objective response rate was 44%, and responses were similar regardless of whether patients had somatic or germline mutations. Researchers also measured prostate-specific antigen and other indicators of drug response. The PSA response rate was 55% among the 115 BRCA-mutated patients, with measurable and non-measurable disease. Patients, particularly those with BRCA mutations, commonly experienced fatigue, nausea, anemia, and elevated liver tests. The drug does carry warnings for myelodysplastic syndrome, acute myeloid leukemia, and embryo-fetal toxicity. Since the FDA granted accelerated approval in this indication, Clovis will have to provide confirmation of Rubraca's benefit in this setting in the Triton-3 study, which is currently being conducted. And finally, in the same drug class, the FDA approved a new indication for olaparib, which goes by brand name Lynparza, to include its use in combination with bevacizumab for first-line maintenance treatment of certain women with advanced epithelial ovarian, fallopian tube, or primary peritoneal cancers. Lynparza is a PARP inhibitor, in the same class as Rubraca, which we just discussed, and Zejula, which we talked about last week. The FDA based the approvals on results of the randomized, placebo-controlled Payola-1 trial, which included 806 women with advanced, high-grade epithelial ovarian cancer, fallopian tube, or primary peritoneal cancers who had received first-line platinum-based chemotherapy and bevacizumab. In the trial, researchers randomly assigned 537 women to maintenance therapy with Lynparza, dosed at 300 milligrams twice daily, plus bevacizumab dosed at 15 milligrams per kilogram every 3 weeks. Lynparza treatment began a minimum of 3 weeks and maximum of 9 weeks after final chemotherapy dose, and treatment continued for up to 2 years or until disease progression or unacceptable toxicity. Results showed significantly longer progression-free survival in the Lynparza group compared with placebo. Among patients with BRCA-mutated tumors, progression-free survival was 37 months in the Lynparza group and 21 months in the placebo group. Among women with BRCA mutations, median progression-free survival was 19 months in the Lynparza group versus 16 months in the placebo group. And for the coronavirus this week, I wanted to start this week with a quick overview. The number of new coronavirus cases confirmed in the United States has steadily declined over the past week. In New York, the figure has dropped over the past month. The numbers have plunged in hard-hit states like Massachusetts and Rhode Island, and some states, including Vermont, Hawaii, and Alaska, are reporting few new cases at all. But that progress is tenuous and uncertain. The nation has reached a perilous moment in the course of the epidemic, embracing signs of hope and beginning to reopen businesses and ease the very measures that slowed the virus, despite the risk of resurgence. With more than 2/3 of states significantly relaxing restrictions on how Americans can move about over the last few weeks, an uptake in cases is widely predicted. Months after the virus began spreading, only about 3% of the population has been tested for it, leaving its true scale and path unknown even as it continues to sicken and kill people at alarming rates. More than 20,000 new cases are identified on most days, and almost every day this past week, more than 1,000 Americans died from the virus. Social distancing is working, but needs to continue even as we move to reopen business and moving back to what will become the new normal. Some numbers for you, and these are as of Sunday, May 17th. Total worldwide cases for the coronavirus rose to 4,769,108, and total deaths worldwide rose to 314,489. In the United States, total cases rose to 1,514,230, and total deaths rose to 90,246. We'll keep you updated as things continue to evolve with the coronavirus. And that's all I have for right now. I hope you enjoyed today's episode. I'll include all links in the show notes below, so please go back and check those out too. Please connect with me on any of your social media platforms and give me feedback on what you heard today. I'd love to know what you thought about the episode. And as always, feel free to like, share, and subscribe wherever you listen to your podcasts. And thank you so much for tuning in. I hope you enjoy the rest of your day.